but I'd like to welcome our audience to our second installment of our speaker series on health and racial equity. My name is Kathy Hyde, and I'm your moderator this morning. Our topic today is achieving health equity through public policy and community organizing. And it is therefore my honor to introduce our two panelists. Each have been healthcare policy champions, fighting at the forefront of health and racial equity issues throughout their careers. We first have Assemblyman Evan Low, who has been a supporter for Community Health Partnership, its members, and the healthcare safety net. Assemblymember Low puts values into action for constituents of the 28th Assembly District. He is a leader in health equity and social justice as chair of the Legislative LGBTQ Caucus, vice chair of the Asian and Pacific Islander Legislative Caucus, and is a member of the Select Committee on Reproductive Health, Select Committee on Infectious Diseases, and the Select Committee on Uplifting Girls and Women of Color in California. Additionally, the Assembly member has advocated for universal basic income for Californians, has proactively engaged our community health centers throughout the pandemic. He's championed bills on healthcare access, telehealth, resources for community clinics and frontline workers, disease prevention like diabetes, hepatitis, HIV, and has pushed for equitable COVID-19 testing and vaccines for Santa Clara County. Welcome, Assemblymember Low. I'd also like to welcome Santa Clara County Supervisor Cindy Chavez, who has the distinction of serving as the president of the Board of Supervisors during the height of the COVID-19 pandemic. Supervisor Chavez represents District 2 that encompasses East San Jose, where many of the communities were hardest hit by COVID-19. During her career in public service, Supervisor Chavez pioneered a universal health insurance plan for Santa Clara County children. And as chair of the Santa Clara County Children, Seniors and Family Committee, she has pushed for policy and programs with a health equity lens and incorporated a community organizing approach to advocate issues at the state and federal level. Most recently, Supervisor Chavez led the effort for the closure of Reed Hillview Airport. She is currently working on issues involving health equity, housing, public transit, fair wages, and the adoption of a comprehensive equity pledge for all county programs. Thank you, Supervisor Chavez. With your permission, I'd like to begin with a question, which we will ask Assemblymember Low first, and then follow with Supervisor Chavez's response. So the question is, how did your life experience and personal values lead you to a career in public service and influence your policy work on behalf of health equity and social justice? Assemblymember Low.
And give Cindy a promotion. First of all, it's good to see all of you. Thank you so very much for helping to gather and convene today. Your time is very valuable, so I recognize that and appreciate the opportunity to have dialogue about how we can help support our local community and strengthen the work that we have ahead of us. Of course, the work could not be done without the incredible staff that I have on my team, Celeste Walker and Mao Yang, very strong, dynamic women, and of course, it's a pleasure to be with other incredible women as well. So thank you very much for that, Dolores and Kathy. I think it just goes to the importance, which is to say that we must not be afraid of politics or our politicians, which is to say that growing up, I too was supposed to become a doctor like my father, when in fact I saw that I cannot, as former mayor of Campbell and as state legislator, I cannot afford to live in my community. And the communities are Cupertino, Los Gatos, Montesano, Saratoga, Almaden, Willow Glen, Rose Garden, Cambrian. These communities have priced individuals out. And so when we think about the equity lens, how do we ensure that those servicing these communities also have the fundamental access and the ability to thrive just like everyone else. And when we think about the equity lens, whether or not it's access to housing or that of healthcare or basic fundamentals to access to voting or civic duty, that's why it's important that we engage. So I think I'm hopeful that we can think about government and politics and democracy in a different way, which is that our democracy is very fragile. And it's important that we engage and get into the arena, that we know who our state legislators are and our county supervisors are and our school board members and our city councils. Yes, I know we lead very, very busy lives, but you can also see the genuine impact that each of these policymakers has on our day-to-day lives, that with one executive order, one proclamation, that it could change the fundamental day-to-day lives that we live. So it's important that we understand who our elected representatives are, and by the way, know who their key staff persons are. They of course are working for each and every one of us. I work for you. Supervisor Chavez works for you. We are public servants. We are your employees. So please put us to work and help ensure that we're doing what we can to help advance the interests that you care about. So again, the nexus between that of engagement and the obligation that we have as public servants is front and center, especially when we think about major challenges, whether or not it's a drought, coupled by the COVID pandemic, and also there's a recall, and you turn on the TV and you feel the incredible empathy for those who are in Afghanistan. But these are the type of conversations that we have day in and day out. So I hope that we'll think about it from an equity lens about how we can make sure our government and our government representatives work for us each and every day.
Well said.
Thank you. Supervisor Chavez.
Thank you. Assemblymember Low, just well said. I think just really important points. And I think, you know, one thing, and I'm sure everybody on this call will relate to what I'm about to say, is at some point, the justice light bulb goes on for you. And what I mean by that is that all of us growing up decide when we're going to choose public service over another route. And all of us on this call are public servants. And I think Assemblymember Low made a really good point, which is he had two paths to choose, or many, many, many paths. But you know, he could see what his father had done that was so great for our community, and he could see what others had done that was so great for our community, and he made a choice. You know, one thing I'll just say is that, you know, I grew up in a household with a mother and a father who really believed in so much about the world that was really positive. Like, my parents believed that everybody in our community was part of their community. So if somebody in our neighborhood needed help, they came to our house. And so I grew up thinking that every household was like that, because I grew up in Casa Chavez with Ray and Carmen. One of the other things I'll say growing up that I knew is that when my dad had a union job, we had health insurance and we would go to a regular doctor. When he didn't have a union job is when we really relied on the clinics that so many of you, you know, the service that you provide here. And I really started to understand that pretty early on, that if we were thinking about how we could support families, we had to be thinking about health and healthcare as a core component of justice and equity. I'll just close with this thought about why, like, I don't think about health equity as just one issue. I mean, if you think about it, health really should be in the root of all of our policy making, all of it. And the reason that's important is that whether we're talking about income, whether we're talking about housing, whether we're talking about healthcare, whether we're talking about clean air, all of those have to do with the physical and mental health of each of us as human beings. And so health equity is core to equity. And if we're thinking about equity as this emerging movement, health is just it's an accepted, to me, it's sort of the foundation of how we're going to be approaching these issues. The county actually put forward under Senator Cortez's leadership a resolution to deal with structural racism really through our health policies, as I think that might have even been the first thing he did as we were moving forward resolutions around equity. So we have a lot of work to do. I'm very excited to be with all of you, super excited to be here with the Community Health Partnership and my dear friend, Evan, and looking forward to more questions.
Wonderful. Thank you so much. We're going to jump into our next question, and we're going to start with Supervisor Chavez. So hopefully she can take a sip of water, take a breath. The next question is, how have your constituents helped inform your priorities, and how can they support your work on behalf of them in the area of health equity and social justice? And can you also perhaps share some of your priorities for the coming year? How we can get involved and how we can prepare for whatever battles are ahead of us.
Okay, that was not one question, but Kathy, okay, but we're gonna take a stab at it. I mean, I think let me just make one point that almost every great idea that we have comes from you all. So our relationship with the Community Health Partnership, our relationships with the community, and I know Evan can make this case, I can talk to you about so many issues where we learned about it from the community. As an example, you know, when we fought in this county to be the first county and the first city in the nation to offer every child access to health insurance, that was in the early 2000s. Just thinking about how long ago that was. But when we did that idea, that initiative really came from community leaders engaging with the community. And you know, Bob Brownstein and others were really kind of thinking about, how do we make sure that children, irrespective of where they come from, irrespective of their family's income, have access to health insurance as a universal right? That created an enormously broad coalition of leaders that really cared about kids in our community, the Community Health Partnership, the Healthier Kids Foundation, PACT, Working Partnerships, the labor movement. You know, all of these communities came together to say, not on our watch. Like, every kid's going to have health insurance in our community. We're too wealthy. Kids are too important. Like, let's fix this. So one, I would say, is that we get our great ideas come from our partnerships with all of you. The second thing I would just say, and I'll talk a little bit about, you know, what our priorities are right now really have to do with COVID. But just let me add one more thing to this. You know, we, in the Santa Clara County, we test every rape kit that we receive in less than 30 days. We are the only county in the country to do that. That came from an idea from a constituent who called me to ask a question about whether or not we had a backlog of rape kits. That prompted us to do all kinds of research and to recognize that the national standard was supposed to be 30 days, and it was only a recommendation, a guideline, not a mandate for any local government. So anyway, Kathy, do you need me to wrap up so Evan can go?
No. You take a few more minutes. Absolutely.
Okay, because you have your hand up.
Oh, sorry.
It's like, all right, so you've trained me. Okay. So anyway, my point there is that now we have a program that's of national, has a national standard to it, that is giving the County of Santa Clara an opportunity to put pressure on the other 58 counties in the state, but also to push national policy, you know, at a national level. And I'll just wrap up with this in terms of the, you know, the main issues that we're going to be looking at. In partnership with all of you, we've got to get everybody vaccinated. We've got to get booster shots out. We've got to get children vaccinated. And we've got to deal with wildfires and the impact to breathing and lungs that's going to have, power shutoffs, because we're going to be coming into some heat waves. We have quite a lot on our plates to deal with that is emergent. And if, in fact, we're doing this from a perspective of equity, the policy making that we do is going to make sure that we get to every corner of our community, to every neighborhood, to every household, and to people who are unhoused. And the test of whether or not we meet all of these parameters is really how well we do. And let me just say, here in Santa Clara County, 81% of everybody in our community is fully vaccinated. It is the highest number of any large county in the country. The only reason that happened was our partnership with leaders like Assemblymember Low, our partnerships with the state, our partnerships with the federal government, and frankly, our partnerships with all of you, leading the way, the Community Health Partnership and the City of San Jose. we are in a different position than most of my colleagues in the country because we're a team. And teams don't always work perfectly, and that's why we keep talking.
Thank you so much. Assemblymember Low, I know I kind of snuck in 3 questions for Supervisor Chavez, so I will summarize those for you. You know, how can we keep your office informed? How can we communicate best what's important to us as your constituents? And what are your priorities on health equity, social justice, and how can we help you?
I appreciate the question. Well, first, I see that there are 116 participants on this Zoom right now. For those of you who haven't already followed via Twitter or Facebook or Instagram, please do so for Supervisor Chavez and myself to not only communicate with us, but to find out what's going on. And then similarly, tweet at us and or share on social media what we should be doing, where we should be focused on, and what we should be prioritizing, and what is important to you and your communities. Invite us to neighborhood association meetings and other events that you might be a part of. Similarly to those 116 participants, let's make sure each and every one of you are registered to vote, and also that you, in this short period of time, get 5 more people to register to vote. These things matter. This is about accountability and about delivering for the communities that we represent. So the call to action to engage with us on social media, to sign up for our newsletters so that you can be informed on what we're working on. And potentially, perhaps you might be able to tell us what we're doing well and some opportunities of what we should be doing, because oftentimes the policy and the directions that we have are guided by your feedback. And so, especially during a time of COVID in which we might not be able to see each other in normal places of gathering, it's that much more important that we communicate and hear from you directly. But also, Kathy, you mentioned an issue about equity and social justice. I, as you mentioned, serve as chair of the California LGBT Legislative Caucus and vice chair of the Asian Pacific Islander Legislative Caucus. And the priorities locally are so important. And I'll suggest to you that I'm a hometown boy, just as Cindy is a hometown girl. We both are graduates, we're fellow Spartans as well. But we care about our communities, and that's why we have a deep sense of ownership of it. And what you may not remember, or I'm sure many of you do, if you look at Cindy's background right now, I'm actually sick and tired of seeing that background, but the fact of the matter is she was on these calls on Saturdays, on Sundays, on Zooms during the really difficult times during COVID. And it's amazing to see that. I said, Cindy, I would text her. I said, do you ever go home? She's like, I'm in this office every day, because she cares about our community. And that's the type of leader that we need. About the social equity lens, about the equity lens as well. We know from facts and data points that in Santa Clara County, there was a disproportionate impact to the Latino and African-American communities, and particularly the east side. And my district is on the west side of Santa Clara County. So what was important is that we need to help focus in making sure that we provide the services directly to the communities that needs it. And that's where having an advocate like Supervisor Chavez to help understand how we can bring all communities together, not an us versus them, but we're all in this together. That's the type of approach that we need. And I've said this as a broken record as well, that if we look at the upcoming census tracts as well, that Santa Clara County, the largest population, will consist of Asian Pacific Islanders, close to 40% of Asian Pacific Islanders. And it's been that of an ally of Supervisor Chavez, who has been a staunch proponent of supporting and uplifting our Asian Pacific Islander community, not just for tokenism to say that's the politically expedient thing to do, but that she cares. And oftentimes, I will just say again, I'm straight talk. That often comes times to battling with limited resources, in which you're saying one community needs resources and the others may perceive it as a zero-sum game. But how do we reframe the narrative saying that when one community benefits, the other also does so as well. But that takes hard work. And I just want to conclude by saying that that's why I think it's important that you hold us to account and making sure that it's not just about what's good for the API community, the Latino community, the East Side versus the West Side, but we're all in this together, that when we are all vaccinated and masked up, that we all will be helping each other. And that's why it's so important when we think about the equity lens. So I'm going to be headed here shortly to another committee to advocate and looking for, by the way, you're hearing it first, for some other statewide measures to help strengthen some of our measures so that we can get out of this pandemic. But I wanted to again thank you, and again remember that call to action, that we need you to engage with us and to be part of the solution. We can't just let the government be the solution to all these problems, but we must take it upon ourselves to also get into the arena and engage by serving in boards and commissions and fundamentally register to vote. So I appreciate all of the time that you've shared with us today. So don't be strangers, and we look forward to the continued conversation.
Thank you so much, Assemblymember, and we do appreciate you making the time for us, and we will actually send out to our audience the social media hashtag links and how to sign up for your newsletter so that everyone can do that very quickly. Thank you.
Thanks, everyone. Take care. And
Thanks,
greetings from
Evan.
Sacramento. See you next time. Bye, everyone.
Keep up the good work.
Awesome. So what I'd like to do now is I'd like to turn the floor over to Supervisor Chavez to speak about, and we've talked about grassroots advocacy, community engagement, how the people influence our elected officials. We give them the power to do things for us. And we would like Supervisor Chavez to speak about, the perfect case study of community engagement. Speak about why grassroots advocacy works in the context of the historical decision by the Santa Clara County Board of Supervisors to close Reed Hillview Airport. And really talk about how community organizing, grassroots advocacy can improve public health, advance social justice and racial equity for not only a historically marginalized community, but for all of us. Supervisor Chavez.
So yeah, thank you for that. And I want to talk about the approach we've had in partnership with all of you on vaccinations, and then I want to talk about Reed Hillview, if that's okay. I just wanted to make an acknowledgement that so many of you who are on the call are members of or partners with the Community Health Partnership. And I just want you to know that part of the reason I was talking about the 81% vaccination rate, and frankly, we have 86% of our entire population that's 12 and over that has had at least one shot. And the significance of that is that would not have happened, absolutely would not have happened without our partnership with all of you. And one of the tools that we used to do that was really partnering with you on being able to work with you and the communities you represent, in addition to bringing on community health workers and promotoras. And I want us to understand that we have a lot of power in our hands when we work together. And it was really in partnership with the Community Health Partnership, the Health Equity Task Force that Magdalena Carrasco leads, and a number of other entities, the Health Trust and other partners that really, and Working Partnerships USA, that really allowed us to take a tool that has worked in our communities for generations, and brought that forward, funded it, moved that resource through nonprofit organizations, helping people get directly on doors and on phones to be able to talk to our community. We need to keep our foot on the gas there, but I want to say that our partnership has saved lives right now, like right where we are. And I don't want to ignore that. Like, we're having success every day. And I want to say thank you to all of you who are part of those programs. And also thank you to all of you who've been part of our community ambassador program to really get the word out in terms of how we're addressing, this issue in the future. And, second of all, let me just pivot, if it's okay. I'll talk about Reed Hillview. So just a minute of history on Reed Hillview Airport. So Reed Hillview Airport has been a staple in the east side of San Jose since 1939. The county in the 1960s bought that airport and expanded the airport. And as we expanded the airport, the city of San Jose expanded housing. And so we created, whether we intended to or not, was these two land uses that definitely did not go together. And that part of East San Jose was really set aside from the city for workforce housing. So people who were coming out of World War II and who were looking for a place to settle down, and we were trying to grow the valley at that time, and these two incompatible land uses were right next to each other. In 1986, my predecessor in this seat, then Supervisor, now Congresswoman Lofgren, brought an initiative to the board to try to close the airport. She had one other supporter at the time and lost on a 2-3 vote. In 1996, almost 10 years later, or 10 years later, actually, I don't know if it was to the day, but to the year for sure, Supervisor Blanca Alvarado brought the same initiative forward and lost on a 2-3 vote. My point there is that they knew there was a problem, and it was incompatible land use. They were concerned about noise. They were concerned about traffic. They were concerned about many, many things. And the way the airport is structured is the FAA tells us what we can and can't do with the airport, even though the county owns and operates the airport. And it's a terrible partnership, actually, because they won't let us do much about noise. They won't let us do really much about curfews. They're very, very hard to deal with at a national level. And we then saw that the EPA did a study in about 2011 that looked at the health impacts of airports. And the health impact that they were most closely looking at then was to take a look at how we were addressing lead. And in their study, they showed that Reed Hillview it had the 28th highest ambient airport air quality, and that lead was a key component of it. Now, at that time, the pilots were saying to us, well, that's because of lead paint and lead pipes, and it's an older part of San Jose. And so really it positioned us to take a deeper look. It was in fact the airport the main cause of lead in children's blood in our community, and could we demonstrate that was either true or untrue? We hired a doctor, Dr. Sammy Saran, and he and the Mountain Data Group, and he pulled a team together of people to do that research. The research took a long time. They partnered with the California Department of Public Health because they had to get all these lead records. But ultimately, what they were able to demonstrate to the community was something that the EPA already knew. The EPA, the American Medical Association, I mean, every institution you can think of that has anything to do with human health acknowledges there is no safe level of lead in the blood of human beings, but particularly in the blood of children. It causes neurological damage, period, hard stop. So we did our own study. And that study demonstrated that children who live near the airport have elevated blood lead levels. And we could prove that that it was coming from, at least significantly from the airport. And the way that that was proved was to demonstrate that if you lived downwind from the airport, where the wind was blowing towards you, where the airplanes were taking off and landing, that you had higher blood lead levels in your blood than you did if you lived anywhere else around the airport, which we used to demonstrate that it was actually coming from the airport. Now, I brought actions to the board as early as 2017 to take a look at this. And, honestly, when I started on the board, I wanted to take a good look. I went and toured the airport. I was trying to think about whether or not it could be an asset and all of that. And someday I'll talk to you more if you're interested on the trajectory that got me to lead the closure of the airport. But that lead study, that very good information, was information we shared with the community. Starting in 2017, we reached out to a number of your nonprofits to ask for your help in helping us once and for all deal with the issues of Reed Hillview on the east side of San Jose. As we started, once the lead study was available, we reached out to a number of organizations, and I want to say the Community Health Partnership, the Collective on the East Side, Somos Mayfair in particular, the School of Arts and Culture, the Grail, and oh my goodness, how am I leaving out one of my teammates out there? Oh, and Friends of Guadalupe. Those nonprofits, along with working partnerships, the labor movement, the Community Health Partnership, Sacred Heart, and the folks that were working on prison reform all jumped in. And the reason was, one, we did a lot of outreach. Two, we knew this area is multi-ethnic. It's Latino, Asian, African American, and that this issue impacts everybody. It's a health issue. Remember what I said a little bit earlier, that health is really the foundation at which we think about the world around us. And we know that if children are exposed to lead at a young age, or I'm sorry, when children are exposed to lead, that it can increase their ability to have impulse management issues that impact the frontal cortex, the frontal lobe, that impact their ability to manage themselves. And that if we're worried about justice reform, or we're worried about environmental justice, or we're worried about racial justice, that this airport issue impacted all of us. And building that coalition is how we went from a 2-3 to a 5-0 vote. It would not have happened without all of you. And I know Congresswoman Lofgren and Supervisor Alvarado did that same work. And my point is that we really built off of the leadership and foundation of both Congresswoman Lofgren. I think in particular, Supervisor Alvarado, who just would not relent on what a challenging, challenging institution Reed Hillview was for the East Side. And it was really off of the strength of those two women and the foundations they laid that we were able to come on and lay these next levels of foundation. Now, we would like our victories to be shorter, right? We don't want to go from 1996 to 2021. But I guess my point here is that we build momentum. Now, the challenge for us is going to be to keep that momentum going, because what this body of work resulted in was the collective and collected like 2,500 signatures. We had another 1,500 emails in addition to those that went to my colleagues. 300 of those from organizations. 300 organizations said, here's what we need to do. And the next phases of this are going to be just as hard. The FAA is not going to roll. The FAA is not going to roll over. The EPA is not going to be as strong an advocate as we need them to be. We're really going to have to work as a community to get the job done. But I just want to acknowledge that plus great social media and lots of press really helped create the momentum that got us where we are. And I'm very grateful to my 5 colleagues. I think the doing this study was really the linchpin also in terms of helping people understand that the risks were not just imagined. They weren't just from living in a poor part of town. They were really being caused by Reed Hillview Airport.
Thank you so much. Just to repeat myself, we are going to be sending out to all of our participants the Facebook and Twitter links to sign up for newsletters. And Supervisor Chavez, you just reminded me, a lot of folks had written to the Board of Supervisors asking them to do the right thing. And they did it. And maybe now we need to remind them we're here and really encourage folks to thank them, because elected officials often only hear about when we want something or when we're mad. And perhaps we can encourage our listeners, our viewers, and everyone else who was on our listservs to take a moment to thank the board, each individual member, for their courageous effort on behalf of San Jose. So we will commit to that, to encourage that to happen.
What's powerful about that, Kathy, is that the thing that's most important about that is that they're going to have many, many, many more votes on this. And the reason for that is that litigation is going to come our way and how we respond. And so I think helping people both to show gratitude, but also that our eyes are not leaving this issue, right? That we're staying focused on it. So thank you and stay strong is the message.
Wonderful, wonderful. Thank you so much. We are now privileged to have some words from our esteemed leader, CEO of Community Health Partnership, Dolores Alvarado.
Kathy, thank you so much. And I want to start out by thanking Supervisor Chavez. Thank you for staying with us. And thank you to Assemblyman Evan Low. I know he had to leave, but I know that our gratitude will go to him through the airwaves, right? So thank you very much. I'm going to take us in a not as different direction, but more of a perspective on where I sit. And hopefully it'll close on a nice note. We are celebrating National Health Center Month. It used to be called National Health Center Week, and we decided a month would be more appropriate. We normally have a big party. Obviously, we haven't been able to do that these last 2 years. So we're celebrating by bringing on local legislators and local speakers who really help us round out our perspective as primary care, community-based primary care clinics. My name is Dolores. I've been with Community Health Partnership since 2011. Just the best part of my life, professional life, has been the last 10 years or so. And we represent 10 community health organizations, nonprofit organizations. They normally serve about 180,000 folks a year. Obviously, last year was an exception due to COVID, but we're back up strong. And I understand as of this morning, we're close to 90% of patients compared to the end of 2019. So we ramped up very, very quickly. This organization, the Association of the Clinics, was formed 28 years ago. And oftentimes people are shocked, like, gosh, where have you guys been? You know, I'm shocked. It's been such a long time. So we're here, we're strong. Our clinics range from being around 30 years to up to 60 years. And Planned Parenthood has been around for 100 years. You know, probably a slightly different name, but same organization. They all provide a full range of primary care services, including optometry, et cetera. So again, thank you for joining the party. I wish we could give you, like, yay, happy birthday, but we're not able to do that. So what you heard now, what you heard in the last few minutes, last half hour is Santa Clara County has really been a leader and has shown that the only way to make change is to include community. I mean, both Supervisor Chavez and Assemblyman Low spoke to that. That's the only way we create permanent change. I mean, I don't think anybody would argue with that. What I'd like to talk about for a second is for us to not forget the civil rights movement. That happened, when many of you were probably not born yet. And the reason I bring that up is that the best way to predict the future, or one of the best ways, is to look at the past. Civil rights movement, the modern civil rights movement, because there's been many, over time, but the most recent one started in 1957 with Brown versus the Board of Education, and that had to do with children who were not admitted into certain schools because of their color, their ethnicity. And then it, quote, ended, although I'm not going to use that word, with the passing of the Voting Rights Act in 1965. It was in that 1960 to 65 period that the community health center movement started, when folks started to see that in certain parts of this country, some areas had a very high mortality rate of infants and mothers, and other areas were doing just fine. So that's how this whole movement, not only began, but made a connection to civil rights and made a connection to healthcare is a civil right. And that's the perspective that I bring. So with that perspective, and fast forward to where we are now, and this is what my staff and I think about all the time. So how do we move forward? How do we address issues like Reed Hillview, like healthcare, like navigation into our healthcare system in context of what happened 50, 55, 60 years ago, the incredible changes in technology? How do we marry both with bringing people in person, but also talking to them through all these social media that I can't even pronounce, but the Twitter and the Facebook and all that kind of stuff. You know, I'm of a different era, but how do we bring that together? And I will tell you that I believe that Supervisor Chavez and Assemblyman Low and many other of our legislators have become experts of doing that. Perhaps they didn't want to become experts, but I'm sure their staff pushed them in that direction. So that's a whole new way of community organizing, which I am embracing and my staff is embracing. And then the third piece of that embrace, that hug, is how do we bring people who are normally the silent community? And I think we all know who they are. Folks who are afraid of coming out, whether due to their legal status or otherwise. How do they get engaged? I don't have the answer this very moment, but I am challenging us and you to think about that. I also challenged us and you to think about what that connection looks like between healthcare, civil rights, way back to the Martin Luther King days, and community organizing. How do we pull this together and then marry it with policy development? And both Supervisor Chavez and Assemblyman Low spoke eloquently about how to engage, how to have this two-way communication. And I love I love Supervisor Chavez too, but Assemblyman Low's comment about invite me to your neighborhood associations. I work for you. So make me, I'm putting words in his mouth, make me earn my pennies. Because I know that they both work that way. So that's a big commitment that we can make today. We know, and I know you know, and I know you've seen this, that creating policy behind closed doors, as beautiful as that policy may be and well typed out, never results in improving anything because it was created behind closed doors. And we have examples of those too. We all do throughout the country. So where do we need to go? My thinking, and I think my staff shares this, creating movements in context and not forgetting the past, like the current civil rights. I say current because it's the most modern, but looking towards the future with the technology and the skills that people under age 30 bring. I mean, that they bring a powerful perspective. And I will tell you that I sit down with my staff and they lecture me every day. No, Dolores, that is not reality anymore. Okay, so let's bring it together. Let's pull it together and come up with a better solution. So creating movements in context of the past, looking towards the future with technology and the skills of our new workforce, plus the participation, and I feel so strongly about this, of those most affected. And I say that because of my background about being an immigrant at the age of 10, not speaking a word of English. So it's something I never forget. Pulling all those together, at least from my perspective, is a nice recipe that will in fact make a difference. That's how these are minimally the ingredients of the recipe that I'm offering. I've also learned over the last 10 years, and particularly from many of the past legislators, starting with Supervisor Alvarado, who called me one day and said, do you care about children who are being exposed to lead? And oh my God, like no one had asked me that question. All the way from that to where we are now with Supervisor Chavez and Assemblyman Low and others calling to say, we need your help. We need your help in looking at this. What is your perspective on it? I think all those pieces coming together really do make a difference in the outcome. Is it a perfect outcome? Perhaps not, but it is certainly a robust recipe. So my message is bringing those pieces together, not forgetting the most recent past and learning from it and asking ourselves, why didn't the civil rights movement stick? Why is it that some people are still disenfranchised? Why is it that certain communities are still being lynched in certain parts of our country? When we have this beautiful law that sits in Washington, D.C., I've seen it, by the way. It's a beautiful document, civil rights. Why is it that that's happening? Is it because we've forgotten? Or is it because it has to be revived and retooled? And I say it's the latter. I don't think we've forgotten. Bring those pieces together, bring your workforce into the picture, and help the new group, the new staff coming up in the world to learn about the past and how that informs them for the future. I also want to, so thank you again for your time. And I also would like to invite you to our third series of this great celebration, which will happen in probably next month, having to do with what Community Health Partnership does with interns. And we'd like to showcase some of the interns that we've had over the years and show you where they are 5-6 years later, where they are in the world of healthcare and in the world of community healthcare, and how they've espoused and really integrated the civil rights perspective. We have had students who were on their way, such as Assemblyman Low, to medical school. And after being with us for a year, they've decided to become policy folks and just, disturbers of the peace, so to speak, to challenge the status quo. I don't think their parents were too happy with me, I have to admit. But I want to show them off. And I also would like to share some best practices that we've learned the hard way and espoused on how to bring in interns and help them decide where they want to be or how they want to be when they grow up. So with that, I think we're going to close, and I thank you very much for your time. This has been an incredible presentation, one that's near and dear to my heart. And the struggle will continue. And my struggle is to bring together the past, the present, and skills that I yet not have, and technology that I still don't know how to work. And how do we pull it together to reach, what are we, 1.9 million, almost 2 million people in this county. So thank you.
Thank you, Dolores. Yes, we will be sending out an invitation to our third and final in our series. And the emphasis will be on workforce development. The best way to create an inclusive health experience is to have folks who look like us, come from our neighborhoods, serving us as healthcare providers. So we thank you for your time, and keep an eye open for an email from us with additional information. Thank you so much.
Thank you. It's fun being with you.